So targeted therapies are predominantly approved in the adjuvant setting. There are 2 hallmark trials in the early stage setting that would become standards of care, and that's based upon ADAURA trial, which looks at the classic 2 EGFR mutations, EGFR exon 19 deletion and L858R mutation, and following complete resection plus or minus adjuvant chemotherapy, Osimertinib is given that targets EGFR, and really striking and impressive hazard ratios in both DFS and overall survival. So that's become standard of care, but that's given postoperatively. The other trial that is quite similar design is the ALINA trial, and that focuses on ALK rearranged tumors. And again, that's in the postoperative setting following complete resection. No chemotherapy is given in the Alectinib arm, but Alectinib is given for postoperatively, and that was compared against chemotherapy. And also really impressive and striking hazard ratios for disease-free survival. So both have become standards of care and targeting either EGFR or ALK. The difficulties with the, one of the disadvantages of the adjuvant approach is that it really delays our best systemic therapy for a long period of time. Patients go through surgery, they have to recover from surgery, and in the ADAURA regimen, if you give chemotherapy, you gotta wait for 4 cycles of chemo, wait for recovery, and then the osimertinib is given in the ADAURA regimen. Now, chemotherapy was optional in that trial, but it seemed that stage directed, most patients are getting chemotherapy, particularly if they're stage 3 and stage 2. So it takes a long time, upwards of 4 or 5 months before the patient gets that targeted therapy agent. And in that time frame, other things can happen, progression can happen, and we're delaying that best systemic therapy when the recurrence rates are very high. So what neoadjuvant therapies or perioperative therapies do is to bring those targeted therapies really prior to surgery and start the systemic therapy agent upfront and give it upfront prior to surgery, go to surgery, and then after surgery to give more of the targeted therapy. NeoADAURA is a phase 3 registrational trial that looks at osimertinib for EGFR with a perioperative approach. There are several phase 2 trials that are looking at this, Nautica-1 being one of them, that looks at various targets, including Alectinib for ALK. So the future is to get those drugs into the preoperative setting. Challenges are going to be the molecular testing for the targets, particularly in global trials where we try to roll out these phase 2, phase 3 trials in a multi-institutional global setting for registrational approvals. It's going to be challenging to get those molecular testing done worldwide.